was diagnosed with the lupus. I was also diagnosed with Hashimoto's at the time. Again, a lot of autoimmune disease. That was the moment that really opened my eyes for me to see, there's something that's happening in the American healthcare system that I wasn't aware of before that feels very misaligned. It's a profit-driven system, and so when something is profit-driven, naturally its actions are going to be taken toward profit, not the well-being of its people. And so I've heard so many horror stories of people in the system who have experienced a lot of hardship from a system that's supposed to help you, and instead they've been really hurt by it. And this feels really connected to the reason why I'm here, because it feels very personal to me.
Most people think healthcare is broken beyond repair, but what if someone already built the solution? Today we sit down with Michelle Natalina, co-founder of Rice and purpose-driven visionary, who's launching a bold new healthcare ecosystem that puts power back in the hands of the people. She reveals why the system failed her, how she's fixing it, and why this launch could change everything. Stay until the end. This is the future of healthcare, and it's happening now. This episode is sponsored by Inevitable Flow.
Welcome to the Inevitable Cast. This podcast is sponsored by Inevitable Flow. We help architecture, engineering, and construction companies generate a consistent flow of qualified project leads using smart AI solutions. If you want to book a free consultation to find out more, click the link in the description of the show. Our guest today is Michelle Natalina. She is a purpose-driven visionary, transformational leader, and co-founder of Rice, a bold new healthcare ecosystem set to launch in Lakewood, Colorado. She blends inner transformation, system thinking, and community-centered innovation to reimagine how health, well-being, and human potential can be supported at scale. After years of deep personal evolution, Michelle now channels that journey into building Rice, an integrated, intelligent, people-powered ecosystem aiming to revolutionize healthcare as we know it. Today, she joins us to explore what truly means to design systems that align with human flourishing, community resilience, and a new paradigm of health. Michelle, it's a pleasure to have you here, and I cannot help myself but ask, what experiences or inner shifts led you from digital design and creative fields into purpose-driven system transformation?
What an intro. That was such a great intro. Thank you. I'm really happy to be here. And that is a really great question. I think since I was a kid too, I have always felt this greater calling to serve and make the world a better place. And being in athletics my whole life, when that ended, I went through an existential crisis, an identity crisis. I started asking myself the questions of, why am I here? What do I want to do with my life? And at that time, just because, we live in a world where you have bills to pay and rent and things like that. I became a digital designer at that time only because I had bills to pay and I really enjoyed the act of design and making things look pretty. And working with other people. But in my heart and in my soul, I felt something greater calling me. And this was also a period of not only am I going through an identity shift, I'm also going through a lot of physical sickness. It was the first time in my life that I had ever felt such imbalance in my physical body to the point where it's like, I took for granted my physical body just because this was a time where all of a sudden my body isn't working for me optimally. And so it started a whole, long story short, I was on a medication, ended up being diagnosed with drug-induced lupus because of that medication. That diagnosis started a whole trickle effect of other diagnoses in my body. And so I think I was 23 at the time. And so this was really a period where it's like, not only do I not have my physical health, I am on really shaky ground. I have nothing really to hold on to, not even my own sense of self. And so everything in my life became a mirror for me to see myself in. I could no longer run away from that. And so I decided to go inward. And that's really what started this whole journey of purpose and, stepping every day and becoming the version of myself that I want to be every single moment. So,
Michelle, I'm curious, in this journey, what was the moment you realized I'm supposed to build Rice?
Yeah, so the moment was at the time I was living in Charleston, South Carolina. This is when I was diagnosed with the lupus. I was also diagnosed with Hashimoto's at the time. Again, a lot of autoimmune disease. And that was the moment that really opened my eyes for me to see, there's something that's happening in the American healthcare system that I wasn't aware of before that feels very misaligned. It's a profit driven system. And so when something is profit driven, naturally its actions are going to be taken toward profit, not the well being of its people. And so I've heard so many horror stories of people in the system who have experienced a lot of hardship from a system that's supposed to help you, and instead they've been really hurt by it. So that was the first moment that I was like, wait a sec, there's something that's going on here. And this feels really connected to the reason why I'm here because it feels very personal to me. And then I felt a calling to come to Colorado. Ended up going on a walk one day with my fiance, and I was like, "You want to just move to Colorado?" And he was like, "Sure." So we just packed our bags and moved. And when I first got here, what I loved about this place is it felt like a place so open to healing and connection. And that's something that I was really craving at that period in my life. And so I decided to join a Tai Chi and yoga studio, which is where I met Crystal, the other founder of Rise. And it was just like fireworks. It's like a soul sister. It feels like, you've known each other for lifetimes and you're coming back together again. And so I came on to Rise at the tail end of the first version of it, which was AI health plans for large self-funded employers. And we went through this beautiful journey of that first version, coming in on the tail end of that, but then really trying to understand the human more, and what does it mean to unleash your full potential, and what does it mean to truly be healthy and optimize like health beyond just the physical level, emotional level, mental level, so targeting all aspects of health. So I think it was the moment actually that I met her that I knew, there's something here and I have to be a part of it.
Amazing, amazing. It is not a hard yes to say yes to go live in Colorado. I gotta say,
Totally.
it's an
Totally. Oh my God, it's like a dream. I'm like, people here, it's like the background is mountains. I'm like, whoa, I'm used to cornfields and plains. I'm like, this
yeah.
is crazy.
And specifically where Lakewood, Boulder, this range area, it's such a unique environment because it's right at the edge of two very different landscapes, right? On the
Totally.
east side you have the plains. They're endless, like all the way to the east coast. And then on the west side you have the beginning of this mountain range that spans from Alaska to Mexico. And right there in the front range where you decided to set home is like this incredible edge, and there is so many like unique things that happens on the edge that it does make it for a very unique place to be.
Oh, totally. And that's also the beautiful thing about being here is I think just the energy here, again, there's something even with literally the landscape, the plains and the mountains, there's something so special that I feel really attracts and brings, a certain group of people here. So it's like I've really been able to also find, my tribe here and the people that I really resonate with and can grow with and expand with. And that has been such a blessing to me because it's like I feel my whole life too, on some level, I had always kept myself in a box and made myself small. And so it's this beautiful thing now where not only are we doing something so revolutionary that is so personal to me and feels like literally a part of me, I get to do it with people who are supportive and loving, and just people you can really grow with, which is like, wow, you know?
Ah, now that we know who you are and where this came from, let's explore how RIS actually works behind the scenes, okay? So RIS isn't a traditional health plan. It is a coordinated ecosystem with six major components. How do these parts work together in a way that feels simple to the end user?
So the great part is, and this has been a big thing, we launch August 1st. That's our set launch date. And so it's been this thing where, I've been speaking to people, and it's this beauty of really simplifying the complexity, because there's a lot that's going on behind closed doors, but the user experience, just because everything runs so smoothly, they're not realizing how complex everything is behind closed doors. And so everything that goes into this health plan, it's basically just replacing the traditional healthcare system that we see today. You have the pharmacy, the plan administration, you have the care delivery, the care coordination. And so there are these different components that come together, that and utilizing a lot of technology. That the beauty of this is that everything talks to each other. So in the traditional model today in healthcare, you have a lot of different moving pieces. It's more complicated than it is complex, because nothing's talking to each other. There's not a technology that's being utilized on all fronts to assist people in care. And so a lot of times what happens, and which is also really interesting, 40% of hospitalizations are because of adverse drug effects. And these things are occurring because things aren't talking to each other. So you have someone who, let's say someone goes into a doctor and they provide all their health information, they're prescribed something, and then they go to another specialist. Well, a lot of the time, whatever is underneath there isn't speaking to each other. And so this eliminates a lot of the complication of the healthcare system, creates a system where employees don't have to pay for care, which is also another thing. When I started learning about the healthcare system, I was so shocked. It just felt so confusing, because it's like, okay, you pay a premium. So now you have to pay a certain amount of money. And then on top of that, you have a copay. And then you have a deductible that you have to reach. It's like there's so much complication and a lot of like moving pieces with the money. It's like, why can't I just pay like one price and then have my care settled for? It just didn't make sense to me. And so that's also the beauty of this model, is employees, everyone that comes under the Rise health plan, doesn't have to pay for care. It is a PMPM model. And so the employer would be paying a set price per month per their employee, and the employee doesn't have to pay.
And let me ask you this. What does it look like for an employer to adopt a RISE plan? How simple or complex is onboarding them into the ecosystem?
So that's also the beauty, is it's turnkey. So which means basically you sign up, you register for this health plan, and then boom, you have access to everything. There's like an employer dashboard, so you can easily see, okay, what are the benefits of this plan? Who decided to go with this plan, not go with this plan? How are my employees doing? And also the beauty of this is, I think for the employee, is not only are you receiving care that is designed to help you optimize your health and your potential, but as an employer, it's like you want your employees to be healthy and happy. And the healthier and happier you are, the more that, especially if an employee feels cared by their employer, like, you know what, I'm working for someone that truly cares about my health and my well-being. It's like I'm going to want to work harder for that person and that company, because I feel that they actually care for me. And so for the employer, it's super easy. Just register, and then they get access to everything. And everything is like a seamless, integrated experience. So it's no
Right.
more like complication like how it's traditionally today.
And talking about seamless integrated experience, as you bring together AI platforms, care network, pharmacy, navigation tools, PCT hubs, what's been the hardest part of integrating all of these pieces into a unified experience?
That is a great question. I will say part of the beauty of this is the phenomenal people who are here to build this. And so any complication that has occurred, it feels it's been very easy to work through and manage. And I also think that is because of the way that we organize ourselves. And so, Crystal is also brings in so much magic here, where she is really a master of bringing things together and coming up with a very simple, cohesive, clear plan. Um, and that's also the beauty is, we're the visionary and the planners, but we have so many exceptional people that are here to really build and do this. And so everyone has their gifts, everyone gets to be in their gifts, and We just get to help direct. And so I think honestly they've made our job very easy as we're
Amazing.
still building.
Nothing like a good team, right?
Yeah. I mean, it's everything. That's also the thing. Like Crystal and I have had so many conversations about this, where it's like, especially with CEOs, it's of big, large companies, it's like we would be nothing without the people that are helping build it. So it's really everyone has a very important role to creating the whole. And so I also love being in that kind of environment, where everyone is equal in that way and valued.
Yeah, totally. And let's zoom into the present moment. What are you working on right now that you think you're going to be pushing toward over the next 6 to 12 months? What are the major milestones you want to achieve over the next 6 to 12 months?
That's a great question and very important to know because Chris and I call it, our North Star, where it's like, where are we heading? And, we have this big grand vision of really disrupting and changing healthcare to really support people. And so, what do we want to experience, right? And so, the next 6 to 12 months, at least on my side, because she's really great with like, the planning and organizing, bringing things together. I'm on the other side of that coin of like community and people. And so, my bread and butter is connecting with people and other change makers and people that want to make the world a better place. And really, my driver is making impact in community. And so, the next 6 to 12 months on my side personally would be really connecting with the community because our goal is we want this to be more than just a health plan and more than just revolutionizing healthcare. This is really a movement where getting a lot of people are waking up to the injustice and the misalignment in our healthcare system. There have been a lot of people who have been harmed, who have been hurt, who are really sick and tired of agreeing to the status quo. And there's finally something now that exists that people can adopt and come into to make that change. And so if people just knew that we existed, it's like, we're really powerful in numbers. And it's really a huge motivator and driver in this. It's bringing power back to people, bringing autonomy back to the people, bringing health back to the people. And so, you know, the next 6 to 12 months for me looks like really gathering like large amounts of people behind this movement to
Yeah,
revolutionize healthcare and yeah, really making a difference together.
amazing, amazing. That is such an honorable goal. And of course, Michelle, any ambitious ecosystem faces real world resistance. So let's talk about that honestly, right? We all know that healthcare is notoriously complex and resistant to change. What frictions have you encountered when presenting risk to employers or community leaders?
I will say that, and I'll even share a personal anecdote with this too. I think things get tricky with healthcare because you either have people who have experienced what we're talking about, and so they're like, "Ah, yes, finally someone is saying it." Then
Yeah,
you have the other side of the coin of people who have been either in the system their entire lives, have seen how traditional medicine has really helped people, and really truly just don't know any different. And so there are definitely people out there that, it's like that thing where it's like, yeah, there are things that the healthcare system could be better, but it can be a triggering thing when someone's kind of coming in and being like, well, we got to change it all. So I think that there has been some resistance in terms of, I'll even share, like, I made this one video on TikTok, for example, and I talked about my personal story about how, I was diagnosed with drug-induced lupus and how I won't rest until the healthcare system changes. To me, that's just a reality that happened to me. And for whatever reason, the video ended up going viral. And I received so many, I mean, I would say probably 70 or 80% of the comments were extremely negative and hateful, saying that that didn't actually happen to me. And, you think that you can like change the healthcare system. Like, who are you? You're just one person. And so I think for whatever reason, when it comes to healthcare, it can be a really triggering thing for others when we're talking about change because people are used to something and if you don't really know the nuances or have an idea of how things can change, it's like, well, why change something? Why? You know,
yeah,
so There's definitely been resistance, but it's also been a great motivator because I know that if I'm touching on something that is bringing up a lot of like anger or anything like that, then I know that I'm hitting something that really needs change. So it excites me. It used to be like, oh God, please no. But now I really welcome that with open arms.
You took the words out of my mouth now. If you are creating, this friction is because you are like sparking real change, right?
Totally.
And it is hard. You got to
Totally.
endure through it. Yeah.
Totally. And that's something that I also think when you're going against the status quo and going against the grain, you have to be okay with that. And I used to be extremely uncomfortable with that kind of discomfort. It's like I was really used to being more of a people pleaser. And so it's like I just wanted to really be agreeable with others and for people to like me. And so if I'm saying something that someone else isn't agreeing with, it's like it used to feel so uncomfortable. Whereas now I really use that tension as an opportunity to grow closer because I think in the end of the day, despite our differences, the differences that we share are what make us unique and the perspectives that we hold. It's like instead of being so attached to the perspective, remaining open because we can learn from anyone. And so I really welcome multiple perspectives because that's how we learn and grow. And so, yeah, it's something that I've become a lot more comfortable with. It really, I did not like it in the beginning, but I enjoy it now.
Yeah, totally. And still on this topic, what do most people misunderstand about self-funded health plans?
That's a great question. I'm not sure the traditional person really knows what a self-funded plan is, or at least I didn't before I started doing this myself. And so a self-funded plan basically means that it's traditional for larger employers where they basically, instead of insurance, just put a pool of funds together and act as like their own insurance. And so, the beauty with this model is that when you have your own pool of funds, you can choose where to coordinate that care and where to move that money that benefits your people. And you can also drive down cost by like a large chunk. I think our projections are in the 40s range, like 40%. Companies that use us will save 40% of their costs on healthcare. And so, yeah, I'm not sure actually a lot of people even know that that exists or know that that's an option because I think a lot of people, when they think about like health insurance or healthcare, it's like you're thinking about the traditional, United, Cigna, things like that. But there are a lot of other options. And because that we are self-funded, this is also the crazy thing about American healthcare is a lot of these prices are just randomly set. So you can go in, let's say I go into my primary care doctor and I say that, okay, I don't have health insurance. Actually, let's use a hospital as an example. Let's say I get some kind of like procedure done and I don't have insurance. The cost for if I don't have insurance is actually lower than if I were to have insurance.
Yeah.
It's like, what? It makes absolutely no sense. Like my fiance, for example, he went to the hospital and the bill ended up being $3,000. Now, they didn't think that he had insurance, so it went down to 1,000. Well, then he thought, okay, I'm going to put my insurance in because I would think that I'm going to be saving money. He ends up putting his insurance in and the bill goes back up to $3,000. It's like it makes absolutely no sense. So, I guess that's the beauty of self-funded is you're saving a lot of money, and I don't think people know that.
Yeah, totally. And even with challenges, Riz has some massive win potential built into its DNA. And when the ecosystem is fully active, what does success look like for a family living in that community?
I actually love that question so much because success for Rise is health, people being healthy. And so we are personally motivated. It's like our system isn't designed to be making more money. We actually, our Rise is set up as a Rise Association, which is a nonprofit. And so we aren't motivated to make more money. We're motivated. We have like this whole system set up. We have like an employer health score. We have an ecosystem health score that using like intelligent like data points can pinpoint how healthy the people in the system are, how healthy the employees are. And so our motivator is to get people healthy. That's what success would look like to me is people getting healthier, people getting happier. And that's the beauty of that.
Yeah, totally. I mean, I I want to see that future.
Totally.
And Are there any early stories or like small wins or prototypes that already show the future you're building?
That I think this has been one of the most meaningful things I think about stepping forward with everything that we're doing is the people that we've met. And huge wins aside from, the money, the funding, things like that, has more so been the connections that we've made because I think especially with Rise, like when you're here to bring something in and it's like that founder energy, where you have a dream and you feel that you're here to bring something in and you're going to stop at nothing to bring that thing in. And we've met so many people that believe in what we're doing and want to be a part of that. And I think also the beauty with Rise is it's made for the people, by the people, for the people. And so the wins to me honestly have been the connections that we've made because, I'd heard where it's like, it's really who you know. And it's been this crazy thing where in a lot of ways it is because you meet one person, they connect you to another. And then next thing you know, you have funding or you have a network of people who believe in this or someone supporting you in X way or Y way. So really the successes have been the people so far. Yeah.
Yeah, totally. And Michelle, zooming out a little, zooming out of the world of health and, talking a little bit about, tech and consciousness and community, they are also like shifting really fast. And we're in a moment where both AI and well-being ecosystems are exploding, basically. What macro shifts are you paying attention to right now?
So this is the interesting thing is, I think also with like, the big thing right now is a lot of people are waking up to the injustice and misalignment and things. A lot of people are more care more about health and well-being. I'll get to the AI thing in a little bit, but I think with what the wellness space is truthfully, I've learned a lot from that space. I also used to be, just because when I first went on my own inner transformational journey, I was like, I need healing, I need help. And so I was more inclined to kind of to explore alternative options. And so I think there are amazing things in that space. We've met some amazing people, but I also think the cool thing with Rise is that we bring together a lot of different modalities where, Rise is like a balance of traditional medicine and alternative medicine where people have access to both. It's not one or the other. And so there have been a lot of shifts in that space, a lot of discoveries in that space. We're working with some really cool people there. So I think it's cool kind of integrating what's been learned in the wellness space into what we're doing, but making it more holistic, where it's not just physical, mental, emotional, it's really everything. And then on the AI space, I think AI is super interesting. Oh gosh, it's also super brainy, and so there's kind of this other aspect of AI that we have some really, really just brilliant people who are focusing on another side of what's being created right now to integrate into Rise. And so I'm excited for that. I personally am not a tech person, but it fascinates me and I love people who are just, brilliant in that space. So yeah, integrating everything that's happening now, but also thinking outside the box.
Yeah. If you could redesign healthcare from scratch, which is basically what you're doing right now, what role should intelligent systems play versus human care, in your opinion?
That's another great question, because I think a lot of things that are happening with AI now, a lot of people are scared and afraid that, AI is going to take away jobs and things like that. And so I think the beauty about the AI that we're integrating in Rise is that it's designed to help the human. And so, traditionally a doctor today sees like 30, 40 patients a day. There is absolutely no way, and I guarantee most doctors will say the same exact thing I'm about to share. There is no way that you can truly provide adequate care because it's on a time thing. You got to get all these people in. And so how can you truly integrate everything that that person is sharing in such a short amount of time and then have 30 to 40 people a day sharing? So AI really helps to help the provider in making sure that nothing slips through the cracks. It's everything is in one space. If you need to easily access something, it's there. And so, yeah, I think that's also a huge part is not only is the tech helping to like integrate everything, make sure everything's speaking to each other, but it also helps take off a lot of the pressure from the provider. And so they can
Right.
actually focus on like providing great care.
Yeah. They focus on what is the most strategic, the most important aspect of what they do. I want to talk to you now about what's next because Rise feels like a long term movement, not a short term project.
Totally.
So, what is the most exciting aspect of the next phase of Rise that you can share publicly?
I think the most exciting aspect about Rise for the next phase is bringing it into the world, where in one way or another, this has been coming through and being built for the last technically 4 years, if you include everything from the beginning of the journey. And so this has wanted to come into the world for a very long time. And so the exciting thing about this now is it's actually here. And, again, with the launch in August, that will be like the first moment where it's like, everyone's hard work and heart that they've put into this. There'll be like a tangible thing actually out into the world for people to experience. And so that's definitely the most exciting part for me. And then long term, obviously, would love to I just want to see people thriving where it's like there are way too many people in the world that are suffering and sick. And I want to see people like thriving in their life, like every aspect of their life. And if Rise can play a small part in that, then I feel like I have done my job here on earth. So that's also so exciting where it's like I just can't wait for people to experience care that is truly designed to help them.
Yeah. Yeah. And so you're launching in August 2026
Yes.
and you're launching in Lakewood.
Lakewood, Colorado. Yes, that's our first. Oh, this is also the beauty of Rise. I completely forgot about this part because it feels so just a part of it. So the another beautiful thing about what we're doing is it's really designed to strengthen local communities. And so we're starting with Lakewood, Colorado as our pilot. And so basically, again, with self-funded, you have a pool of funds that comes together. And so for Rise, this pool of funds comes in, and then this money is used to pay off health claims. Whatever is left over at the end of the year, that money goes toward the communities. And so people get to vote on what they want to experience in their community. Let's say they want cleaner water, they want to help schools, they want to feed the hungry, that, elderly care, anything like that. That excess money goes into strengthening the local community. So it's this really cool model where it's not only helping to like optimize health and potential, it's also strengthening and reinvesting in local communities where it's like, you kind of become your own hero.
Amazing. And how do you see this model expanding beyond Lakewood?
Yeah, so this is the exciting part is, I mean, it can be integrated into any community, starting in the United States. And really my vision is globally because I think everyone could benefit from something like this. But yeah, I think it could come into any sort of local community. I think in order for us to scale and grow in a way that is still aligned and helps people, there are some strategic partnerships that we're forming right now that could help us scale into communities beyond just the Colorado communities faster. So there's a few things kind of happening there, but other than that, it's super easy to integrate something like this into a local community just because everything is turnkey and super easy. And then we have a really intelligent provider network. So people would be able to receive care anywhere around the US. So that's exciting too.
Yeah, I mean, I can't wait to see this, everywhere. It's
Yeah, it's so
much,
exciting. It feels like yeah, I'm just a really fulfilling thing where, again, so many people have put so much heart into what we're doing. And I'm sure
yeah,
people will be able to feel that.
final stretch right now for the
Yeah.
pilot. And so, Michelle, when we get to the end of the episodes, I usually like to ask this question. It's clear that you have achieved so much with Rise already, and you still have a lot to come. But if you could wave a magic wand today and remove one single obstacle that is slowing you down, what would you eliminate?
I think if there was, and this is really just in general, where if I could wave a magic wand, I would remove the limitations of just, funding and money, where it's like, gosh, if, things have to be paid for. It's like, you need, especially for something like this, where you're starting up a big thing, there's like funding that's involved. And so, gosh, I mean, I can just imagine really for any business owner where it's like if you could just wave a magic wand and you would there was like nothing to actually pay for. It's like boom, you could actually just have it into the world. So if I could wave a magic wand, it'd be that where it's like boop, money out the window, you know.
Amazing. Michelle, it was such a pleasure to have you here today. Thank you so much for sharing your insights, and it is incredible everything that you're building, and I just wish you continued success in this journey.
Thank you so much. It was such a pleasure speaking with you.
Likewise. That brings us to the end of this episode. This podcast is sponsored by Inevitable Flow. We help architecture, engineering, and construction firms generate a consistent flow of qualified project leads using AI powered outbound systems so they can grow revenue without hiring a sales team or relying on unpredictable referrals. If you want to book a free consultation to find out more, click the link on the description of the show. I'll see you next time.